Mark.
All right, we'll go ahead and let everyone in. I'm going
Thanks,
to go and let
Aaron.
everyone in.
Hey guys, we're going to get started in just a minute, but thank you for joining us for our Pellissippi State webinar. All right, you guys, thank you so much for joining us tonight. We are going to be going over the one of our newest programs, surgical technology program. I have joining me this evening Laura Grosick and Lisa Crawford. And before I turn it over to them, I'm just going to briefly go over Pellissippi overview. Um, so some of the reasons we think you should be considering Pellissippi as a choice for yourself is our academics. We have over 100 academic programs. Our value with the Tennessee Promise and the Tennessee Reconnect scholarships. Many of our students attend Pellissippi State tuition free. Our placement rates and internship opportunities. We do have a career development office. They work with all of our students on their resume writing and their interview skills. They particularly work with students that are going into the workforce after Pellissippi to help them find employment within their field. Convenience, we do currently have 4 campuses throughout Knox and Blount County right now. And then student to teacher ratio, our classes are very small, about 20 students per instructor. And last but not least is transferability. So if you're following one of our transfer pathways, we use the Tennessee transfer pathways, then you can transfer your credits from Pellissippi onto a university to go on and do 2 more years to earn your bachelor's if you're doing a transfer program. I do want to add that surgical technology is a career program. So it is designed to prepare you to go right into the workforce after you leave Pellissippi. So if you are joining us tonight and you want to get started with Pellissippi, go to our website. It's listed on the screen, pstcc.edu, and you'll see Apply Today button. Just click there. And then just to get started, to finish your admissions requirements, we do need high school transcripts and college if you have college transcripts. And then ACT or SAT scores if you've taken that test in the past 5 years. If not, you can take a placement test with us. We'll waive that placement test if you have transfer credit in math or English. This is our contact information on the admissions side. So you can email us, text us, chat with us from our website, or call us. And I am going to now turn it over to the surgical tech team to start talking about Surg Tech, which is what you guys are here for.
So I think the the biggest question is that I think the general population has, if you say, what is a surgical technologist? They might not even know what a surgical technologist is. Our name isn't really out there that much. And so I think the reason why is because we are behind the scenes. We're behind the scenes team player in the operating room. So if a patient is in the pre-op area, that's where a nurse comes to get the patient to take them back to the operating room, or anesthesia maybe taking them back to the operating room. But we're the people that are in the operating room getting it prepared for the surgeon, for the patient. And so when the patient's brought into the operating room, then they may see us, they may not. We're usually pretty quiet. We're back with all of our supplies. So that's why I say we're the behind the scenes team player. So what is a surgical technologist? We're a specialized healthcare professional. We play a unique role. We work directly with surgeons. and anesthesiologists and nurses. So if you take a look at the picture here, I've placed an arrow above the surgical tech, and then they're actually doing a hand procedure, and the surgeon's sitting down. Then the nurse is behind him, and anesthesia looks like they're back behind the surgical tech. They must be walking over to the anesthesia machine. So as you can see, the surgical tech is the one that has the supplies ready. There's a metal tray there that holds instruments to the right, and then the back table is where most of the supplies are used. The nurse in the room is the person that would, if there was any supplies that were needed, then she would go, or he would go get those supplies. And I like to refer to a Band-Aid. So if the surgical tech was telling the nurse that she needed a Band-Aid, the nurse would go get the Band-Aid and peel it like a banana. And the tech would take the Band-Aid out because the tech is sterile, no germs on them. And then the Band-Aid is sterile. So the tech could touch the sterile Band-Aid, but a tech couldn't go and get a Band-Aid off the shelf because if they touch the outside of the Band-Aid, there's germs on there. So we're part of that sterile process. We don't want to introduce bacteria or viruses into the patient. So we're sterile the whole time. The nurse is the one that will go and get us supplies. A lot of times, I think that the public thinks of us as a surgical nurse. However, we're not a surgical nurse. So that's kind of the difference there. If you can see the picture, where we are in the operating room. So here's a picture of a surgical procedure. It is a total knee replacement arthroplasty. And if you look to the left, that's a picture of the anatomy of the knee. And I put the slide on there because in surgical technology, you really have to know the anatomy. It's in greater depth than a general anatomy and physiology class. And the reason is because we have to be able to anticipate what the surgeon's going to be doing. So we really need to know the anatomy. And what I mean by anticipate is being a step ahead. So we have to know what's the next step that surgeon's going to do so that we can be prepared to give the doctor the instrument. So the next slide is oh, I'm sorry. Can you go back one more to where we were? Yeah. So if you look at the next picture, sorry about that. That is what a total knee replacement looks like. The picture below where it says A, B, and C, those are the implants that are placed. And the picture to the right is a very nice setup of a total knee replacement. Typically, the cases that we would need, so those big metal cases that are sitting up towards the top, those are what holds all different sizes. So everybody's knee is a different size. We have instruments that will accompany any kind of size. So as a tech, what we need to do is get some information from the surgeon. They would tell us what size the patient would need. And then we have to pull all of the instruments out that surgeon's going to need to perform the knee replacement. Okay, next slide. All right, so again, we prepare the operating room before the patient arrives. This is just a couple pictures here of a surgical tech getting the instruments ready. And again, a total replacement. We also anticipate the surgeon's needs, which I had alluded to previously. This is a slide to show a little bit about the anatomy. So general anatomy and physiology would be on the left side of the screen. And then on the right side of the screen is a more in-depth anatomy and physiology, well, anatomy of the stomach. So if you notice, the vena cava and the aorta are kind of in the center of the stomach picture. Those are the big vessels that supply blood to the stomach and also back to the heart. And so if you notice, there's a lot of small vessels around the stomach. And so just noticing that, then we would know to be prepared for any type of bleeding. We would have supplies ready for bleeding, to stop that bleeding and a repair. So that's what I mean by anticipation, is just knowing the anatomy a little bit more in depth than what's learned in the general anatomy and physiology class. So essential characteristics of a surgical technologist is curiosity, and also having the ability to handle internal anatomy, otherwise known as bleeding. And I think, the surgeons really appreciate curiosity. And so curiosity leads to paying attention. And I think that, the longer that we work in surgery, the nurses, the doctors, the techs that have been there for a while, when we have a student come in the room and they're curious, it just makes us remember the first days we were in the OR, and it gets us excited. So curiosity and the ability to handle, situations in the ORs is what we're looking for. And we prepare you for that too. Another thing that I like to say when I'm teaching is that we are the sterile police. So if you look at this picture below, I put a diagram on there of what you're actually looking at from looking down. You'll see the surgical tech at the top on your left-hand side, the assistant that helps the surgeon, and then the patient. The robot is towards the bottom. So this is a robotic procedure, and the scrub tech and the assistant are sterile. The doctor is sitting at the console, which on the sketch diagram is at the lower right. If you look at the live picture, you can see either one of those professionals that are in scrub attire with their gown and gloves on. They're at the sterile field with the patient. So the patient is draped with a sheet that's sterile, and then they're sterile and they're handling the instruments. The robot is up over top of the assistant or the tech there with the arm coming over, and they're loading the sterile instruments into the arm. And then those instruments will go through a port into the patient, like into probably their abdomen. And then the surgeon is in the foreground, and he's looking into a 3D monitor. Okay. So he's seeing a 3D image of what the assistant and the surgical tech are putting those instruments in with the telescope. And then he can see inside the patient, but he's not touching the patient. So he's actually moving those instruments around with his hands at the console, and is moving the instruments inside the patient. And I think the first case that was done was, I believe the patient was in the United States and the doctor was in England, or vice versa. So this is a big telemedicine type thing. Of course, we'd have a doctor on standby right there in the OR room. But anyway, so what's important about this is that we can watch people moving about around the room. So it may be a sales rep, it may be a medical student, it may be a nursing student, it may be another surgical tech student watching. And so we have the ability to look around the room, look at the clock, look at the anesthesia, monitoring equipment, where the surgeon and the assistant don't have that opportunity. They're looking at the patient into their wound. So they can't look around. They have to focus on that. So they don't have time to be watching everybody moving around. If someone isn't sterile and they touch that sterile field, then we could have a complication of a surgical site infection. So that's why I say we're the sterile police. We're also advocates for the patient, not only for maintaining sterility, but also for their safety. So we're always on the lookout. Is their leg maybe slipping off the table? Is their arm dropping down? All those kinds of things we can pay attention to too. The nurse in the room also does that. But we're an advocate for that patient too. Okay. Just to go over a few things about opportunities for surgical technologist students. You will be exposed to several procedures. Some will be simple, some will be complicated, so it'll give you a well-rounded experience. You will be involved with 430 clinical hours. So that will be experience out in the operating room, and you will be with another surgical tech who has experience. So you won't be on your own. They'll be with you, overseeing you, mentoring you. We have 180 lab hours, and that's where you will learn your skills before you go out to the real OR. So you'll be prepared. We'll do some scenarios and that kind of thing. So you'll be ready to go out for your clinical hours. In order to graduate, you need 120 cases, and that will be in the first scrub role. So that means you will be passing instruments to the doctor. Those cases where you're observing don't count. So we want you to be active and in the procedure so that you're ready and to graduate and be strong and assertive. You'll be involved with a wide range of surgical specialties. So there's general surgery, which is typically the abdomen. Obstetrics is babies, gynecology is surgery for women, genitourinary is the urinary tract, ophthalmic eyes, otorhinolaryngological is ENT, so ears, nose, throat. Oral maxillofacial is typically the oral surgeons where you get your wisdom teeth out, but it's more in the OR instead of the office. Plastic reconstructive, orthopedics, bones, cardiothoracic, open heart, lungs, and peripheral vascular is legs and arms, the vascular system, and then neurosurgery, which is anything to do with the central nervous system and the peripheral nervous system. All right, so as far as employment, the program's going to prepare you for the nationally recognized gold standard certification, which is through the national board, which will really help you to be marketable. So, and then give you flexibility as well. And what I mean by that is once you obtain your certification, you will be recognized across the United States. So it's a national certification, and you can go anywhere in the United States and work. The choices for employment, again, is going to give you flexibility. The program's going to prepare you for those various surgical specialties. So you're going to be well-rounded, typically veering more towards what is really drawing you in. So what you enjoy the most could be the area where you'll be employed. Doesn't always work out that way. But that's what we're shooting for, to have you be well-rounded so that you're flexible for employment. Opportunities after graduation, you can be a specialty surgical technologist, and that means some services do not let you into their service until you work in an operating room and get some well-rounded experience scrubbing on your own. And after a few years of doing that, then they'll let you into the open heart team or let you into the neurosurgery team, and you can do those big cases. You can be a surgical first assistant, and that means you're standing across from the surgeon and you're helping the surgeon. So that's one step up, more education, more training from a surgical technology program. You could work in central supply and processing, which is the department that stores all of our sterile supplies, and they bring them to the OR for us. They also clean our instruments and sterilize our instruments. You could be a college instructor, you could be a clinical educator, you could work in administration in the business office. That's, an opportunity with your background to move around a little bit. Beyond surgical technology, I think some of the questions come up with, oh, this is a dead end job, or, I'm going to be a surgical tech and then what? But really, it does open up the doors. And I think it's because of the exposure. So once you get into the OR and you've been in there for several years and maybe you want to branch out and do something else, you have a group of mentors right around you. So if you're thinking about going on to nursing school or assisting, or you're thinking about anesthesiology or selling surgical products and being in the OR or even into medicine, there is that opportunity because now you're surrounding yourself with people that can support you as you progress. If you don't, there's people that don't, and that's fine, but there is opportunities beyond just surgical technology.
Okay, I think that's where we will take over, Lisa. Thank you.
You're welcome.
So my name is Laura Grosick. I am a health science coordinator. Jennifer Strader is also on the call, but I know she's having some technical difficulties, so I'll kind of take over here a bit. So our role as health science coordinators is we kind of help you get to the being able to apply for our surgical tech program. So it is an application process, and there are some classes that you take before you get in to the program. So we're kind of your guide as you go along. So this program is at our Blount County campus. It is the first year is, of course, fall. You'll be taking general education courses. In the spring, you'll take some general education courses, and then also alongside some surgical tech courses. So between the fall and the spring is when you apply to get into the program. So that that first semester, you're going to be taking like your A&P and your medical terminology, and then second semester is where you get a little bit more into the surgical stuff. Then in the second year is where your clinicals begin. So and it's kind of broken down here of how that will be, but it is a pretty intense in clinicals. So you can pretty much expect that you're going to be, it's like a full-time job, right? Like you're going to be working either in clinicals or in class pretty much your 40 hours a week. And then also you have studying too. So keep that in mind that this really is a program that is going to require you to be in person doing hands-on things. And with the clinicals, they'll be placed in the greater Knoxville area and Blount area. So it's, again, as Lisa was saying, it's a 1-to-1 ratio. So we're going to have to use a lot of different partners in order to make sure that you get the experience that you need. Next slide. Okay, so I did talk a little bit about the admissions process. One of the first things that I just want to point out is there is a background in drug screening. So when you're going through the admissions process, that is, after you're admitted, it's contingent on being able to pass a background check and a drug screen. So keep that in mind before you do all your studies. We use a rank score, so we kind of rank students, and it's based on what their GPA is. And then we look really, really closely at their math and sciences that that you take, and that medical terminology class. We do give extra points for those that have already an AAS or a BS or a master's degree. And then we're also looking if you have a CNA, a medical assistant, an LPN, or a surgical tech diploma. So all of those things kind of give you points, and it's based on a point system on who gets in the top amount of spots that we have in the program. Next slide. So that is the bulk of what we have to share with you. We're really excited that we have this option for students. So I'll let Sarah kind of take over.
Yeah, so I'm sorry, I meant to mention at the beginning, if you have any questions, if you guys could type those in the Q&A box, we'd love to answer any questions that you all have. But the contact information is on the page for Lisa Crawford, who is the director of our surgical tech program. So we'll give you guys a minute to think about any questions that you have. I think, is there one more slide? Okay.
Yes.
Oh, sorry. And then we've got the health science coordinators email contact information as well.
And I did just realize there is an error. There's an R. It's GROSEK. I should have caught that earlier, but So if you want to email me, it's lmgrosek@pstcc.edu.
Thank you, Laura.
Mhm.
Okay, I don't see that we have any questions for tonight, but please reach out to us, you guys, if you have any questions. And we'd be happy to help you guys answer any of those questions that you have, whether it be about surgical tech or Pellissippi in general. Thank you guys so much for joining us and have a wonderful evening. Okay, guys, everybody's logged off. I'm so
Okay.
sorry. I do not know how to end the meeting.
No,
I'm
you-
looking.
You
I'm
did
looking